Attendees are in listen-only mode.
Show my screen right here. Click the play. Good evening, everyone. I just wanted to let you know it would just be a couple more minutes and we're going to get started here, but thanks for attending and we'll get started shortly. Good evening, everyone. Thank you for attending this webinar today. My name is Lisa Jennison, and I'm a neural resource facilitator with the Brain Injury Alliance of Iowa. As you will see on your GoToWebinar control panel, you have two options for listening today, your mic and speakers or telephone. So if you're having trouble listening with either option, try and switch to the other option to see if that helps. We will be recording this webinar today and we'll have it archived on our Brain Injury Alliance of Iowa website in the coming days. That web address is biaia.org. Also, we will save a few minutes at the end of the session for any questions you might have. Please utilize the chat box for this on your control panel. And no CEUs will be provided for this webinar, but a certificate of attendance will be sent out to all registrants following the session. Now, I would like to introduce our guest speaker today. Benny LaHue is an executive officer at the Iowa Department of Public Health and heads the Office of Disability, Injury, and Violence Prevention. She has been at the IDPH for 17 years and coordinates the department's work in these areas. She staffs the Iowa Violent Death Reporting System and focuses on related injury and violence prevention activities. Benny received her Bachelor's of Science degree from Kansas State University and her MSW from the University of Iowa. In this webinar, she is going to review the incidence of falls and the relationship to brain injury, common risk factors for falls and steps people can take to prevent them, along with the resources that are available in communities. Now we'll go ahead and let Benny get started. Welcome, Benny.
Thank you, Lisa.
I'm just going to get started and get our recording going really quick here. Oh, perfect. All right.
Good. So we are good to go. Thank you, Lisa, and I'm very glad to be able to join you all. I appreciate this opportunity. This timing of this is pertinent to the fact that we just ended September, and that is Fall Prevention Awareness Month. And so we've been doing a lot of work promoting awareness about falls and fall prevention. As Lisa said, I work with the Department of Public Health in the Office of Disability, Injury, and Violence Prevention, and I work closely with our brain injury program manager, suicide prevention coordinator, disability prevention staff, and also other programs related to injury and violence prevention. And that is why I'm going to talk with you today. So let's get started. And again, I want to reiterate, please feel free to type in questions at any time. We will either check them periodically and answer, or we'll wait till the end. So the first thing I want to talk about is basically just the data, what we know about falls and the relationship that they have to brain injury. But before I start crunching numbers here, I just want to make sure you're on the same page with what we define as a fall. This is a technical definition. It really is a sudden, unexpected change in a position, often where someone lands on a floor or it be a lower surface. An intercepted fall, where maybe someone catches a person or part of them, is still a fall. And a fall without an injury is also still a fall. And when we look at data, we'll talk about this in a minute, the height of the fall, whether it's from the same level or 3 feet or 20 feet, is really not a factor in what we define as a fall. So I guess the key points I want to make is it's important that you all know that 1 out of 5 falls really causes a serious injury that can result in broken bones or a head injury. And specific to traumatic brain injury, falls really are the leading cause of TBI. More than a third of adults who are 65 and older fall each year in the United States. And really, it is a leading cause of death, falls themselves, in persons 65 and older. So it's just important to recognize that they are a significant public health problem. In Iowa, we've seen over the last decade that the rates of deaths from falls have exceeded the deaths that we would have seen from motor vehicle crashes. So it's really probably more important that we're addressing falls in many ways than we are other issues. And some other key facts I thought you might find interesting. Really, and unintentional is the term we use for falls because most of them are not intended. They are a leading cause of non-fatal injuries. We still have a high rate of death from motor vehicle crashes, but we have a huge number of hospitalizations and ED, emergency department visits. Often we see fractures among older women more than twice we do for men. Males tend to, and you'll see this on one of the slides, males tend to be at higher risk for death from falls than females do. And about a third of people who fall really do suffer a moderate to severe injury that would include lacerations, hip fractures, and head traumas. And important, I think, is that a person who falls once literally doubles their chance of falling again. So having a fall is a risk factor for more falls. One of the things that we also see in Iowa is that about half of those that have a fall injury can return to living independently, but really about 40% of our nursing home admissions are related to falls. So that is one of the other impacts of falls, is that it does tend to decrease independence among older people. I'm going to show you a couple of slides, and I know they'll look very detailed, but just to point out some key highlights. We pull from data to understand falls from death certificates, from hospital records on hospitalizations, and from emergency department visits. And the main reason I pulled this slide to show you is that you can see the blue line are falls, and all the orangey line is other types of trauma. And you can see that we're seeing falls increase steadily in relation to other kinds of trauma that are seen, which are decreasing. So that's why we're really beginning to kind of ramp up our efforts to do more in this area. Now I'm going to show you both TBI information and falls information, and I don't want to confuse them because they're kind of exclusive. We are just in the process of updating our injury data, and this slide, another one I'll show you, is hot off the press. Basically, if you look at the last 5 years, it shows us what the rates of hospitalization are for all ages. And while falls certainly affect all ages, babies as well as all ages, clearly the rates of hospitalization for traumatic brain injury increase significantly as Iowans age. And I would say most of those that are in that higher age, over 65, are basically resulting from falls. The other thing to note is that males, being the blue line, have higher rates of hospitalization than males. And you'll see, again, probably around 45 or 50 is when people's rates of TBI hospitalization increase. Now, this next slide might be hard for you to see because the colors didn't come out quite as good. This is not TBI anymore. We're talking falls. So I thought this could be one way to show you, depending on where you live, those counties that are the darkest are the ones that have the highest rates of falls hospitalizations, and these are based on a 5-year average. The white counties would be the lowest. Rates of hospitalization don't necessarily have anything to do with geographic, but that's where we see the higher ones. It may have to do with age, with industry, because people can have falls through work, occupation, as well as at home. But again, this is just to show you that spread across all the counties for hospitalization. And now, excuse me, this goes back to death rates for traumatic brain injury. As you can tell before, where we had rates of 550 for hospitalizations, we have fewer deaths. However, over the last 5 years, death rates for traumatic brain injury also show an increase as you get older. So people that are older are at much, much higher risk. And as you can see, too, men being the blue bar, males have a much higher death rate than women do. Typically, in younger ages, like 24 to 55, it may be because of their occupation and their higher risks they take, like climbing on ladders when they shouldn't. But that's basically why we see those changes in death rates. And the next slide is back to all falls, not just traumatic brain injury. If you were looking for your county, you might look on this to see if you are still one of those top 25% of the counties that had highest falls death rates. One of the things that we think does influence this is the access your community may have to emergency medical services, because if you live in a very rural area where it may take a while, or you have mostly volunteer paramedic services, you may not get to the hospital as quickly as in some urban areas near the level 1 trauma centers. But basically, in general, the deaths that we have in Iowa, the highest rate is going to be from people between the ages of 50 and 64. 65 and over have the highest rate. In Iowa, our death rate from falls is 84.3 per 100,000. And I'll try not to bore you with other details like that. I thought it would be interesting to show you then what is the primary result of falls. This is a report we had issued based on our emergency department data. And just to point out, so if you look at the bars that are the orange color, those are head injury. Obviously, the other kinds of results, as I mentioned earlier, may be bone fractures, an arm fracture, a hip fracture. But head injury is basically kind of a larger proportion of this, except with the underage, under 16 males, you see a lot of arm fractures. But basically, more falls result in TBI, basically, for males, and similar for females, although you do see a lot more arm fracture and some kind of hip fractures or pelvic fractures in women, but you can see where the brain injury is in relation to the other types of results of falls. And then this is basically what is the result of what happens after they leave the emergency department. What is the status of their discharge? So again, the good news is that you see the majority do go home in this. This again was a study from Iowa data over a 5-year period. So about 61% of the patients do get to go home, but as their age increases, so you'll see for the 65 and over folks, they're going to be going to probably skilled nursing, rehab, and then there's that small sliver of those in the gray bar that will die from the fall. So again, we see an increase in older folks needing, as I said earlier, losing their independence and needing to go move into a home, a residence. So just to kind of wrap up this section, because this will lead into our next section, I just want to emphasize that when we look at what causes the falls that show up in emergency departments, the majority among all ages are really from a slip, a trip, or a tumble from the same level of surface. And that's, the vast majority. I want to say like 60, 70%. The next most common cause would be a fall coming from another height. So it might be someone tripped down a stair. Maybe they were going from a curb down to the street or up. It might not be a very different height, but that would be the next most common. And I think it's important that a high proportion of falls for men under 65 is them standing on a ladder. And so just, tell those men in your life they shouldn't be doing that work on the ladder anymore, I guess. That's my moral of the story. So next, we're going to spend some time talking. And so let me just say right now, if you have other questions related to kind of data about falls, go ahead and type that into your chat section, and we will get to them in a bit. But I'm going to move on then to talking about our common risk factors for falls and some of the things we recommend for preventing them. And knowing that most of you are caregivers, again, I think it's important to think about how this will apply to those you are caring for that have traumatic brain injury, but frankly, for all of us, once we get older, past the age of 55, really. So the main risk factors for falls are people who have lower body weakness, their strength is poor, they may have difficulty walking or even maintaining their balance. They may have foot pain from other conditions such as diabetes, or wear really poor footwear, for example, wearing flip-flops if you're going hiking, puts you at risk for falls. Certain medications can be risk factors, and we'll talk a little bit about this in a minute, but the kinds of medications that really can impact your balance would be tranquilizers, sedatives, even antidepressants, and there are some over-the-counter medicines that can affect your balance and how steady you are on your feet. In Iowa specifically, we live in a northern climate, so being deficient or having not enough vitamin D is also a high risk. And so oftentimes doctors will recommend a vitamin D supplement. Having limited vision or problems with your vision also contributes to falls. And certainly there are hazards in the home, such as kind of broken or uneven steps going into the home, having rugs that we might trip over, no handrails. And we'll talk in more detail about some of these. But it's important to know that really most falls and the risk for falls are caused by a combination of risk factors. It isn't just that your difficulty walking or that you have vitamin D deficiency. So the way we look at responding to this is to really address it in a comprehensive way and to try to do what you can to mitigate all of these risk factors. And one thing that I do want to mention right now, because there are some documents that have also been uploaded to this webinar. One of the documents that is loaded is called, it's a brochure, but it's called Stay Independent, Assess Your Fall Risk. Might be labeled assessment. It has a wonderful checklist that you can use to assess your risk or a loved one's risk. And I think it's a great tool to use. So be sure to note that. And as I mentioned, the most common cause of a fall is slipping and tripping. And so these are just some examples of photos I found. I love the polar bear on the ice, but we're getting to be near winter season and we don't know, that could be a risky time for everybody. Looking at an example of soles of shoes, because those can also affect your grip and your walking. The pictures on the bottom are pictures from an insurance company of the ones they've taken where actually falls have occurred and there were lawsuits. So you can see on the left and the bottom, even just a small little rise in the concrete can cause someone to fall. This one on the lower right is, believe that's a hose, but having an object like that or a cord. Again, simple, easy things, but they can really result in a fall and serious injury. As I mentioned, too, there are many risks in the home. This shows examples of rugs that are not properly surfaced, that are slippery. So they certainly recommend you can get those little sticky things or rug a gripper that you can put on so they won't slide. The other rug shows one that's kind of bent and worn. Again, another kind of a slip hazard. Certainly having poor lighting in the home so you can't see where you're going or see something that might be in the way. And even having lack of handrails on stairways or areas in the bathroom, for example, that might help you grab. I also want to mention to you that in one of the other documents that have been uploaded, there is a checklist for safety, and it really is geared toward home fall prevention checklist, and again, covers everything from your floors, your stairs and your steps, the kitchen, bathrooms, bedrooms, and just other ideas for preventing falls. So again, it provides some great examples of checklists you can do and ways you can address those risks in the home. So we talked about this a little bit in our data, but I just wanted to reiterate, as I said, falls can cause broken bones, any parts of the body, hip fractures, and we know they can cause head injuries. And I think that, again, you all know if you have a loved one with a head injury, how serious they can be, but the medicine is a piece of it that really can add risk. So, for example, if you're on a medication that's a blood thinner, that would cause more likely of serious internal bleeding falling from a fall. And I think one of the other things that is important is that many people who fall, even if they're not injured, become afraid of falling. And this causes them to be even more cautious in ways where they may not be as comfortable walking or adjust where they go. It may even result in them not wanting to go anywhere because they're afraid of falling. And that's very unfortunate kind of, I think, byproduct of a fall, because what happens then is if you stay at home and you're not out as much, you might become less active, you become weaker, and then your chances of falling are even greater. So it's important that you understand the kind of impact of that, because we're going to talk in a bit about what you can do to reduce your risk of falling. The other thing that I think is important, because I hear this a lot, is that many people won't tell their doctor if they've fallen, or they think they're okay. Maybe they had some bruises. And it's really important, especially for someone, I would say over 60, that anyone who falls, especially if you hit your head, but you should see your doctor to make sure that there's not other serious injury. And doctors are also a resource for doing more risk assessments for you. So now we're going to talk a little more about some of the things you can do to help reduce your risk of fall. So we're going to start with talking to your doctor. So if you have fallen recently, tell your doctor. If there's no other reason to go to the doctor, make an appointment. They have checklists where they can evaluate your risk for falling, and they may have suggestions for what you can do. They also could review your medications, but they could also give you some recommendations on maybe vitamin D supplements or calcium, but any other type of medication that could help reduce your risk. The other thing is that in Iowa, we're really trying to educate our primary care providers about referring people for a fall prevention class, which we'll talk about in a little bit. The other thing is that your doctor could do this or refer you to someone, but also being properly evaluated and fitted for adaptive equipment, whether it's, a cane, a walker, maybe you need eyeglasses, better shoes, but those are the kinds of things that a doctor can help you assess and give you advice on. So it's really critical that you let your doctor know about the risks or if you have concern or if you have fallen. Regularly reviewing your medications. I remember talking to someone recently who said that they had a fall, went in and talked to their doctor or nurse practitioner, and they realized there were several medications they'd on that they really didn't even need anymore. And after having those taken away, they were significantly better to walk. They had less dizziness. And so as you get older, and we all tend to have more chronic conditions, we can get on medications that maybe can affect that. So making sure you assess with your pharmacist can do this as well as your doctor to just look at your medications, tell you which ones might be contributing to extra dizziness or sleepiness. And it should include not just your prescription medications, but again, any over-the-counter medicines or supplements. And as I mentioned earlier, recently they've indicated that certain antidepressants, especially the SSRIs, can contribute to fall risk. So it's important that you really pay attention to this piece of control. And I've noted that in communities where they have health fairs, many times they will provide pharmacists or pharmacy students that can help you review your medicines. The other thing I'll point out is that there is a handout also on the uploaded documents about prescriptions, and it gives a little bit more detail about the types of prescriptions that can contribute to fall risk. So be sure you look at that one as well. A really important piece of prevention is strength and balance exercises, basically just physical activity. And so walking is, a very good thing to do. Now, if walking is difficult, we'll talk in a bit about ways you can kind of renew and improve your strength and your ability to walk. But obviously what that does is it makes your legs stronger and improves your balance. The picture in the middle is a picture of someone doing Tai Chi. It is an Eastern form of exercise, and we'll talk a little bit more about a form of Tai Chi we're offering here in Iowa, but it has been proven through research that it is probably one of the best types of exercise you can do to reduce falls. I'm seeing Tai Chi become more available in communities across the state. Many YMCAs are now offering Tai Chi classes. There is a chair rise exercise. So if someone that you love or that you are caring for is really very limited, but they can stand, there is this chair rise exercise, which you see the photos, is very basic and could help with repetition to improve someone's strength in their legs. That would again improve their balance. And the particular exercise that I showed in the picture here is also included in that attachment on the list of attachments on the webinar. And that would be a basic exercise that probably any healthcare provider might recommend that someone do. As I mentioned, having your eyes checked is a really important thing. Many people's vision changes over time, but obviously poor vision increases your chance of falling. And probably once you're over the age of, I'd say 50 to 60, you really should have your eyes checked, depending as well on your family history. People may have certain eye conditions like cataracts, glaucoma that can limit your vision. It's important to have that identified and addressed. Even people, I'm one of those folks that I wear progressive lenses, but It means that if I'm walking, I might not see something close if I'm looking farther away. So it might even be helpful to simply have one prescription for doing outdoor activities. But again, vision is another risk factor for falls. So making sure you're having those checked, your eyes checked regularly is very important. Making your home safer. And again, I mentioned that one checklist that you can access from the documents. You know, the kinds of things around the house are cluttered objects, things that are in the path and the way you trip over, especially if you get up in the middle of the night and you go to the restroom, you'd want to have a clear path. As we get older, and I notice this whenever I travel and I visit hotels, just having grab bars that are available inside or outside your tub or shower or next to the toilet, not using the toilet roll holder for a grab bar, but using them, again, can help you if you've got a wet surface, such as your floor or your bathtub. You can make sure that your stairways have railings on both sides, not just on one side. And obviously, bright lights, getting brighter light bulbs, but making sure you assess those areas where fall risk is there. And we mentioned a little bit about just the rugs having some kind of a grip on them, and even making sure your tubs have non-slip mats or those surfaces you can stick onto the tub that help you stand and not fall. I like this image, and I don't know how clear it is for you to see, but it talks about going through the home and kind of preventing falls step by step. So again, it talks about your bathroom, medications in the drug cabinet, well lighting in the hallways, on the stairwells, spills that can cause a risk for slippage and falling, walkways have clutter, throw rugs, etc. So again, this is a great way to kind of think through your house room by room and what are some ways you can look at your own space to prevent falls. And now I want to talk more specifically about resources we have available in Iowa communities. Iowa, the work we're doing in Iowa has been kind of coordinated by the Iowa Falls Prevention Coalition, and we are a group of many folks working in the aging community, in healthcare, hospitals. Brain Injury Alliance is a member of the coalition, public health, and we get together and we share data and we talk about strategies. And basically, through the efforts of the coalition and a grant we received a year ago, we've been able to really increase the availability of community-based fall prevention programs. And some of these are adaptable for people who even have limited mobility or may even be in a wheelchair. I can't tell you that all of the teachers know how to adapt them, but we basically have tried to provide a range of programs so that people at all levels of activity can benefit. And so I'm going to talk to you about these three and mention them. In my opinion, they're kind of I'm going to talk about them in kind of a graded way. So a good place to start if you're very new or you've fallen and are very frightened is to start with our Matter of Balance classes. They've been around in Iowa for a long time, more than 10 years, and are pretty well spread out. It's an 8-session program, about an hour long, and the main purpose is to reduce a person's fear of falling and just to get their activity level increased so that a person then can begin to walk or do those other things that help build strength. We collect data on all of these, and I'm always amazed at the ages. Many of them, because they've been sponsored through area agencies on aging, will primarily have people starting in their 60s. We have people in their 90s taking these classes that talk about their ability to feel more comfortable and more strong. So again, because they're evidence-based, that means they've shown to have this kind of a result. So Matter Balance is one level. The next level is Stepping On. It's a course that was created, I guess, in Wisconsin. It's a little more intense. It's a 2-hour class. It's done over 7 sessions, and people do it over a 2-month period. And really, the purpose of that is to help people learn and adopt better safety strategies and behaviors that improves their strength, so they reduce risk. It's got a little more physical activity in it, and many of these programs will consult with a pharmacist or physical therapist to give you more information. If a person's had a matter of balance class, stepping on would be a great succession to that in your community. And then the last one that we've recently introduced is Tai Chi for arthritis. I mentioned earlier that Tai Chi, again, has been around for a long time, and it's very well known. Basically, studies done on Tai Chi in general shows that it reduces fall risk by almost 50%. So in Iowa, we've done an adapted version, which is supposed to improve people with arthritis, improve their mobility, and decrease some of their discomfort. It's a weekly class. Sometimes people offer it once a week or twice a week, and it's based on a particular style of Tai Chi. But again, it is proven to reduce falls in community-dwelling adults. And as I mentioned, many of the YMCAs are now teaching their health instructors, their exercise instructors, to offer Tai Chi for arthritis. But I'm going to show you a map that shows you where we have leaders in the state. So this first map, these are our matter of balance classes. So the dots that are red and green are master trainers, and each class, master trainers can train other leaders or coaches. And so you'll see that, again, we've got master trainers kind of all over the state. The southwest part of the state's a little bit more kind of vacant, but these folks then have the ability to go on and train class leaders and coaches. And it seems to me there should be matter balance classes pretty much within a multi-county area where you live, because they've been around the longest. The next one is stepping on, and we just began offering stepping on. So this map shows you who was recently trained last year that is available to provide stepping on classes. And so again, when we were looking at expanding these, we tried to get them across the state by maybe area agency on aging region or quadrants. We were not successful getting many people in the Southwest, but you'll see there are stepping on leaders at least in major counties. The other thing that I'll mention for both matter of balance and stepping on is that many of the health systems have decided to get people trained, and they're going to be training their other clinics. So, for example, Unity Point has trainers for both stepping on and matter of balance, and they will continue to train the clinic systems across the state. So if there hasn't been anything in your area, there may soon be classes offered through a hospital. You may get a referral from a physician and others. And again, so they're readily available. And then Tai Chi, again, we just have brought them. There were only 3 Tai Chi for arthritis instructors in the state before we provided the training last spring. So you can see the green squares show you who is trained. Unfortunately, most of them are in the central Iowa area, but the goal behind that training was to get some folks trained as a leader, and they will then subsequently train others, and the YMCA is basically committed to training their folks across the state. And there are 34 Tai Chi leaders in the state already who are going to be starting to use this Tai Chi for arthritis. The first classes were just started last in June, I believe. So you're going to see this change quite a bit in the next year. And so this map we created, so this map shows you the area agencies on aging, and you may or may not be familiar with them, but basically we were trying to show how many leaders there were in each region. And so as you see, you've got in every region at least 5 all the way up to 39 matter of balance leaders. There are stepping on leaders in every area agency on aging region, although as few as one, but as many as 10. And then Tai Chi for arthritis, again, right now we only have them in 2 regions, but there are people trained. They're just not ready to start leading classes because they have to practice a certain amount before they can do that. So what I want to emphasize is that you can, we'll show you where you can find out where those leaders may be in your area, but our goal is to get a wide range of resources and classes across the state. And the last thing I'll mention, the cost for these classes is very little. I can't tell you for sure, but many times they may ask you to pay $10 for materials, for the booklet that has the exercises. I know with Stepping On, you get a stretch band and some exercise equipment, but they're very, very affordable. And in some cases, the agency that sponsors it may even be able to provide the class for free, depending on ability to pay. So they really are very reasonable to take for almost anyone. And I'll say one more thing, and that is I think people, frankly, we should be promoting these classes to people in their 50s. Because if you are strong and keep your strength from your 50s, you will be at less risk, obviously, as you get older. Another resource that I thought of for prevention is just to mention that I was going to mention Home Depot and Lowe's, but frankly, we have so many different home improvement centers, hardware stores in many communities, and most of them are going to have the kind of devices and adaptations that have been mentioned. So you can buy rails, grab bars, steps, help make sure you repair your steps, non-slip rugs, the tacky stuff you can put on your steps. So what's important is that if you're looking for that, you can go to your local hardware or home improvement store and say, this is what I'm looking for. Can you show me? And some of them actually have special displays just for falls that covers all that, but they can certainly help you find what would be helpful. And I'm assuming that people who need help getting those kinds of devices installed can find out what resources exist in their community through their area agency on aging or lifelong links. In fact, I would guess as well the neurofacilitators, resource facilitators at BIA probably also have those resources for you. An Iowa Compass is a resource that has great information on adapted devices, has a lending system, and so they're a great resource for the kinds of maybe adaptive equipment a person might need. And so I just want to mention these are the other resources that I'll say. There's a wonderful 3 or 4 minute podcast on falls and traumatic brain injury on the CDC website I thought might be of interest. The Centers for Disease Control also has a great bunch of resources on older adults. So this page gives you the link to that fact sheet and other resources. At the Iowa Department of Public Health, we have a whole webpage devoted to falls prevention, and so the link is there. It includes other resources and brochures. The Iowa Department on Aging as well has some information on falls prevention, mostly for older Iowans, but again, similar and relevant information. And if you're interested in finding out more about what classes are available from those evidence-based classes, this link at the Iowa or the area agencies on aging would tell you who to contact and how to reach them. There is another brochure that I haven't mentioned yet that is also on your documents, and it is one that actually was produced by EMC Insurance about preventing slips, trips, and falls. And they also have just some great ideas and resources that are tips for prevention. They've been an active member of our coalition, and I thought this was a great resource. So I would say that pretty much I've provided most of what I think would be available and useful for you to just kind of grab and use. At this point, this ends the slideshow, so I think we will do some checking on questions and see if you have any. There's still time if you haven't typed in a question or have one to do that, but we will check to see if there are any questions out there, see if we can answer those. I'll read it. I've got one. This person says, I have an individual who is very unsteady when he walks. When he starts walking, he goes way too fast and uses walls or vehicles or other things to stop himself. He has recently been required to use a walker when he uses the, here, I got to make sure I get this whole thing in here. Oh, thank you. I just got to make sure. Okay, here we go. When he uses the house. However, the ramp coming out of his home is very steep, so I'm worried that the walker going too fast will obviously cause him to fall rather than prevent it. I currently walk in front of him and keep the walker slowed down, but this is very physically strenuous. Do you have any suggestions for how I can assist him with this? Great. Good question. Yes. I think, first of all, I would definitely consult with the doctor around if they recommend another device to use. It might be that in some cases people do well with a walker, others may do well with a 3-pronged cane or have other mechanisms. So the other thing I would say is physical therapists as well are good resources for assessing and helping people with gait. And that if you need a doctor's referral, that may be the best way to get that. But I think maybe having someone who kind of gives him those tips, so it's just not reliant on you to do that. There may be home health resources that can help assess that as well. And I would definitely recommend that you have someone, and I'm thinking, hopefully not someone that you have to pay that does construction or repair, but you definitely need to have the ramp assessed to see if it can be modified at all to change the grade on that. And there may be some surface coating on that ramp that could help the grip if it can't be, because I know locations of ramps are very different. But that would be what I would recommend, is that you do some assessment that way, if that helps. And the next one. Has anyone looked into the correlation of texting and walking? Actually, that's funny you mentioned that. I think there have been. And when I was looking on the EMC insurance website, they had some information as well that texting is just as dangerous if you're walking as if you're driving. And so by all means, it is another risk factor for falls, for sure, for slipping and tripping. But yes, there has been research into that. And then didn't a recent study show that calcium intake at older ages does not decrease bone breaks? And if I know what you're talking about, I also remember seeing in our daily health headlines that yes, they're showing that calcium is not necessarily as important as vitamin D in particular. And so I think what's important when you're older that you are assessed for osteoporosis or osteoporonia, because it may be that there may be other medications that are better than calcium. But again, goes back to talk to your healthcare provider about that. And obviously, most folks are getting bone density scans or assessments. But from what I've heard, absolutely, vitamin D is almost more important than calcium at this point, along with strength and balanced training so that you're staying active. And then we have one other question. Do people with a TBI have a higher risk of falling? And that's a good question because it's really the opposite of what I was saying earlier. I think a lot of it depends on the symptoms of that TBI. Obviously, if the TBI results in unsteadiness, affects the gait, definitely that is a higher risk for falling. The medications that a person may be on could also contribute to that risk, as well as, just the ability to concentrate and pay attention. It really depends on the symptoms, but definitely I would say in general, they certainly have a higher risk just because of the different factors that contribute or that are part of the TBI, but also contribute to falls risk. And I think that's all the questions we have for now. Probably time to type another one in, but we're getting close to the end anyway, I think. Doesn't hurt to end early. Is there anything else you want to say, or give people another minute?
Yeah. I just want to thank everybody for attending the webinar this evening. As a reminder, we will have this webinar archived in our website at biaia.org. in the following days. And please fill out the survey that you'll receive when you get your certificate of attendance. And this will be emailed out to you. So I just wanted to thank everybody for their attendance and to have a good evening. And if you do have further questions, you can go ahead and email them to us and we can get those answered for you. So
Thank you.
yeah.
Thank you.